Hey, Connor, how's it going, man?
I'm doing all right. How are you doing, Dev?
I'm doing pretty good. How's your summer treating you?
It's going so far so good. We're tired. I'm excited to be home. We were just on a 3 week long road trip. Ended up being I think 45 hours in the car over 3 weeks. So I'm done traveling for a little while, and I think that's okay.
Right on, man. Yeah, I had some family come out and visit me. I took a little vacation, a staycation. This
Oh
house was
yeah, you had
full,
your sister and
four
all her kids
kids.
there for
I'm glad we
10
weren't
days.
recording, man. Yeah, dude, I had like four toddlers running around on my roof because I'm in the basement. So it was like, dut, dut,
Mm.
dut, 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 ah! And someone hits their head, and it was a full house, but it was good. It was a good time. All right, what do you say we get this started?
Let's get to it.
Well, welcome everybody to the Immersive Medical Podcast. We have a very special guest for you guys today, Joe Rothschild from the CDC. And when I say CDC, I mean the Centers for Disease Control and Prevention, the CDC.
Right. Yeah, you had this one cooking for a while, I think, right?
Yeah, we've been working on bringing Joe to the podcast for our listeners for over 7 months. And we're very pleased to finally have made it happen because we have something very special to show you. Who knew that the CDC was building a virtual reality game or professional training platform? It's pretty cool.
Right. So why Joe?
So Joe leads the virtual reality team of this thing called the OneLab VR at the CDC. And it's a virtual, like 4-story building in VR where there's centrifuges and they train laboratory people or people interested in laboratory specialties. And it's all about safety and public health. And it is really cool, and it is totally free. And we really wanted to talk to them about this innovation because it's, in my opinion, relatively rare for such large organizations like the CDC to dive into such an innovative realm for public health simulation training, which I think is the answer, which is what we need.
So who is Joe? Who is Joe Rothschild?
Yeah, Joe Rothschild, he started his career at the CDC in 2005. He's been there 19 years. But what's really cool is that he, before that, was working in film and television. So I kind of related with the guy a little bit, except for he was working on way cooler shows than me. He was like, he's working on Cops, National Geographic, Entertainment Tonight, Oprah. I mean, he was working on all these incredible shows, and then transitioned his communications bachelor's design and his experience into multimedia at the CDC, which is just such a potent combination because the CDC has such a large lift of educating the public on things. And you have a guy like this there building out or running this virtual reality innovation, and he's got all this multimedia background. It makes it engaging and fun to go into it. And that's actually what you're going to see for this podcast. We also went into VR and recorded it. So we'll be able to show you guys what the OneLab actually looks like at the CDC or the digital CDC. It's pretty cool.
Well, Dev, thanks for taking this one on. I will be producing this episode. I was remote when we were recording, so I won't be on. But it's an exciting episode, and I'm glad we got to get together with Joe.
Absolutely, man. So let's, ladies and gentlemen, please put your ears on for Joe Rothschild at the CDC. We will get back to the show in just a minute, but first, I want to talk to you about VR Patients. VR Patients is your gateway to interactive, scalable, and objective clinical training. It's more than just a learning tool. It's a comprehensive platform that offers industry-specific features for nursing and EMS, making it the ideal choice for a diverse range of healthcare professionals, no matter the size of your organization or school. Dive into the future of clinical competency training at vrpatients.com. That's vrpatients.com. If you have a VR headset at home, you can try it right now for free on the MetaQuest store or Steam. Joe, welcome to the show.
Oh, thank you very much, Devin. Appreciate it.
So before we get into OneLab VR, which is what we're going to talk about today, can you tell us a little bit about why are you working at the CDC? Like, what got you involved there? And how did you get VR going at the CDC? Well done.
Oh, thank you. Yeah, it's been an interesting journey. It's my background is video film. I was a creative sort of multimedia person. I was determined that graduating from college, I was going to go move to LA and be a screenwriter. My last semester at CSU Chico, I took a beginning web design class, got hooked, and from that started doing web design. From that went into e-learning, and e-learning went into working at the CDC. And I think it was really a match made in heaven, because if you think about sort of online learning and education, it really is that mix of sort of video, film, and writing. And so I was able to do that. Uh, Getting VR into CDC, that's a completely different story. It took a while. It's an emerging technology, and obviously it required us selling leadership, getting headsets on leadership, and really, I think if you've ever used VR, that's really all it takes. Is you need to put a headset on, and 99.9% of people become immediate converts.
I gotta say, I'm just super proud to have you here because it's so future forward thinking. I'm gonna admit I never would have thought that the CDC had created a a laboratory in virtual reality for people to perform microbiology tests and spin the tubes and practice something like that. It's so early adoption curve, and that's what I work on it all the time. So you're absolutely right. Of course, it took a long time. The last 5 years have been huge for VR, and 2020 was even huger, as an even bigger deal. So I just think that I didn't even know it existed. So let's just dive right into that. What is OneLab VR?
Okay, so OneLab VR, it's as of today, it's around a 50,000 square foot virtual environment. Within this virtual environment, we have 12 different laboratories. Each laboratory has its own specialty, whether that be microbiology or pathology or chemical labs or BSL-3 laboratories. And then each of those laboratories have their own sort of lab specific instruments and hardware in there. And really, we built it so people can learn and do it safely, do it repeatedly. We were sort of always chasing something that would sort of connect the gap between traditional online e-learning and hands-on learning. And we really feel that virtual reality is that perfect middle ground. It's definitely not a replacement for hands-on training, but for what it is, it's a great tool for sort of skill-based learning and really getting that sort of muscle memory that is required when you're working in a lab down pat.
Man, you're speaking my language. This is so great. I mean, the terms that you're using right now are just so on point with exactly what we talk about at a scalable, reproducible, remote solution for training, for upskilling in healthcare and public health. So,
Oh, absolutely. I think that one of the neat things about VR is that obviously, yes, it's you could do it completely remotely. That sort of that geographic boundary isn't there. Everything in it is repeatable. You could also do things that in laboratories are expensive, using expensive reagents and supplies and things like that. Obviously, there's no cost to do that in VR, as well as things that are dangerous. I think you wouldn't want a first year med student or laboratory tech messing with really dangerous pathogens. Well, in VR, you can do that and you can do it safely. A really neat thing about OneLab VR is we have a multiplayer component. And this
oh, cool.
multiplayer component allows people to join and host live training within this virtual environment. So you can have subject matter experts in pathology, for example, teaching students on the other side of the world live in VR, be able to see each other, hear each other, communicate, and evaluate how people are doing procedures.
So is that what you see if you were to list, say that, top three benefits of VR training in terms of what OneLab is trying to accomplish? Is it this remote? you have a subject matter expert on this side of the world and a learner on that side of the world, and they get to meet and do something expensive and dangerous in a non-destructive environment. Is that really the true north?
I think that that's one component of it. I think another component is if you look at there's a need for more laboratorians and laboratory professionals to enter the workforce. And I think this is a potential great recruiting tool for the next generation of laboratory workers. My kids, much to their chagrin, are often the beta testers for this. I'll say, hey, kids, put on this headset, try to break this. And through that, they're young, they're middle school, high school age, and they're interested in careers in working in a lab just from playing in this virtual environment. I think another thing that we're really trying to do is attract some of the laboratory professionals that have left this career to come back to remind them what was so fun about it. And yeah, I really think it could be a fantastic recruiting tool as well as just a basic skill based learning environment that people can go through.
I love the idea of like youth getting to try something that otherwise is out of reach. I mean, you can read about what it's like to be in a lab, and until you get to probably at least high school, you're not going to be messing with a lot of chemistry or glass vials. And then it's more likely college. And then college can be so overwhelming. You have to make your decision of what you're going to be for the rest of your life. And then you have to enroll in these courses and you're not even sure if you want to take microbiome or not. And to be able to play in an environment that's realistic and real and try it, man, I think that's just potent and powerful.
Yeah,
and you're already doing it. How old are your kids? They're trying it?
Yeah, so I have a 13-year-old daughter, I have a 17-year-old son, and a 19-year-old son. And so my daughter actually has been the master at finding bugs where she'll say, "Hey, I somehow managed to lock myself inside the storage locker." And we'll say, "Oh my gosh, we never would have thought to look at that." And so it's been a lot of fun with them trying it out.
Okay, so if a 13-year-old can do it, then it must be tutorialized, relatively simple to approach. So what's it like when a 13-year-old gets in? I mean, what is your daughter doing in OneLab? Is she really spinning tubes and running experiments?
Absolutely. She's a master at balancing a centrifuge and running autoclaves and
What?
all
That's
that
crazy.
all that sort of thing. And I think with a lot of times people are who are maybe we'll say technically challenged, maybe a little bit nervous about getting into virtual reality because it's a new piece of technology and they've heard stories about motion sickness and things like that. Well, what we have found is that really people, my mother who's 80 years old, has never stepped foot in a lab. She
Yeah.
was able to put on a VR headset and start going through a packing and shipping scenario. And it's the greatest thing watching someone who's not a gamer in VR drop, say, a test tube or a pipette on the floor, reach down, pick it up, and just continue working without me having to say, "Hey, notice you dropped that, so now use your index finger to reach down and grasp it."
It was just natural.
It's so natural, and we've really tried to, as you said, tutorialize it. We have a really nice tutorial that teaches first time VR users hey, here's how to move around, here's how to pick things up, that sort of thing.
So I used to work for the NIH on the Precision Medicine Initiative. I was a clinical research assistant, and we had to use microfuges and centrifuges because we were collecting labs for a genetic research project, and it was very specific. So some of the things that I went through, and I'm curious if there's a correlation to what you guys are doing in OneLab, because that was a research project at scale. It's like all across the country trying to get 1 million genomes. So a lot of people had to be trained on how to do stuff with these little tubes. So you'd collect the labs, and the tube would have its own vacuum inside of it. So it always filled to the appropriate amount. Some of them didn't have the appropriate vacuum in them, and they would be low. and that would be you'd have to recollect that one. But you also would have to know that. Otherwise, you just assume that the vial is filling to the appropriate amount. Once you then have to get it to a fridge in a certain amount of time because it's blood. After it's in the fridge, there is a specific person designated to spinning those tubes. And when I went into the lab to learn it, to see if I wanted to maybe start to shift and transition off of the front end bile specimen collection side to the back end, centrifuge processing and shipping out, I went in and I was a professional being paid, and they would not let me touch that microfuge until I had spent a considerable amount of time with the professional who was used to it, because if I made a mistake, I could put it out of service. They only had one. And so that was designated for the study. So does any part of that kind of flow correlate with what you guys can do in OneLab VR?
Absolutely. So you mentioned centrifuges and microfuges. We have a centrifuge training scenario. Side note, sort of most of our training scenarios in here, we have set to be around 10 to 15 minutes long, because we know that laboratory professionals don't have a huge amount of free time. And so we really want to sort of focus on, the most important aspects of, for example, using a centrifuge, which is properly balancing it and making sure that the tubes you load into it are the appropriate tubes. And so, for example, in our centrifuge scenario, we have it where you get a whole bunch of tubes, and some of the tubes are cracked, some of them are underfilled, some of them are overfilled, some of them are mislabeled, because we have heard from our subject matter experts that just more than the balancing, it's knowing to look and say, oh, wait, there's something wrong with this tube before it ever goes inside the centrifuge. And so it's that muscle memory type of thing of getting used to the point where when you're using a centrifuge or you're pipetting something, hey, I have to look at this before I put it in, or hey, I have to eject this pipette tip every time. So when you actually step foot in a real lab for the first time, you already sort of have that muscle memory of here's what I should be doing. I should be working the clean to dirty principles and things like that.
What, Joe? So, can we just try this right now? I mean, is it that simple? Like if I walked over to my wall and I grabbed my headset, could we jump in to OneLab?
Yeah, absolutely. I mean, again, this OneLab VR is available. It's on the MetaQuest store. You just search for OneLab VR. You'll find it. You could download it, install it. I mean, I got a headset right here. If you want to go grab yours and put it on.
Headset.
All right, let's. I'll get set up and we'll meet in VR together. All right.
Okay, so for all of our listeners, switch over to the YouTube channel if you're not watching, and we are going to be able to cut to. We'll record, okay, Joe, our OneLab VR experience for everybody, and then we'll come back to the recording room in just a second. So let's dive into VR.
All right, perfect.
If you're new to OneLab VR,
skip tutorial.
Please choose the Begin Tutorial.
Skipping. Ooh, the elevator door's just open. Okay, I'm in the lobby. Hey, there you are. Well, hey, Joe.
Howdy, how's it going?
This is amazing, man. So, where the heck are we right now?
Yeah, so this is the lobby of OneLab VR. We sort of imagine this as the fourth floor of a laboratory complex, maybe a hospital, maybe a college, something like that. One thing to note is that with a lot of laboratories, you don't want just anyone to be able to walk into it. So our main doors into the laboratory environment,
My key card work?
you can't open it without the card key.
I had access for my key card. I'm in the club.
There you go. So
I like being in the
we
club.
will head on in.
Wow.
We'll head on in.
Okay, so
Yep.
if I'm here in this space and I'm an end user, is this the type of situation where I'm a student and you're a lab professional and you're about to go in there and teach me a lesson? Or am I a professional and I'm here to do continued education training or new training?
So lots of different ways that we could approach that. In our multiplayer environments, if you want, yes, I could be the instructor, you could be the instructor. That's really open-ended. But we also have just sort of standalone short scenarios.
All right.
So here we have, we're in our specimen processing lab. You could open the refrigerator and you could grab that tray out of there.
That's not where the tube rack is supposed to
There
go.
you go, yep.
Please place it on the indicated
we'll
area
take it
on the bench top.
Over to the workbench and place it right there on that
Look
laboratory
closely
thing.
at each patient's tubes and select 3 correctly prepared tubes with equal amounts of specimens.
Wow. look
So
at that.
one of the goals that we were trying to teach with this scenario is that we found that a lot of times when it comes to centrifuging, you would get a whole bunch of different types of tubes. You'd get some tubes where they were overfilled, or some tubes where they were underfilled, some
Yeah.
tubes where they're cracked. And so really the goal of this is, okay, we got to find the tubes that are properly filled and loaded, and we'll put them right here in this green test tube rack. So we're doing one from the red rack, one from the yellow rack.
Now these ones are different sizes. Oh wow, that one's broken. Oh yeah, it's a good thing I got my PPE on. Oops. And this one is very full. Now this one's a different size. These two are different heights and lengths, so
Correct. Very good. That's a good eye.
we're gonna. All right, let's look at these two. Whoops, not that one. This one. That one's cracked, overfilled. This looks great.
Perfect. You have chosen 3 tubes with equal amounts
You know,
of specimens
What's
in
interesting,
each.
what I really love about what just happened is that I used to run labs when I worked in the hospital all the time. I would draw up labs, and most of these tubes here are already vacuumed, so they fill automatically to the appropriate level, unless they've been damaged or otherwise, right? And so sometimes you might get a tube, and it doesn't fill, and you're like,
Right.
as a newbie who maybe has never drawn up the yellow tube before, you think, well, it's a 4 cc tube, but it only fills up to 1 cc. Maybe that's because in the lab they add something to it. I don't know. And you send it, and then they send it back, and now the patient's waiting even longer for their care.
Yep, and that's sort of exactly one of the reasons why we wanted to do this.
This is great. I can totally see the value of something like this, where you're really trying to do large-scale research. I definitely see the value for a hospital or another lab technician or lab supervisor just at a smaller level, one hospital at a time. But you could do nationwide or worldwide training that is the same, that everyone gets it the same way, uses it the same way, make sure that the specimens are collected the same way, and they remember how to do it. That's an important muscle memory to continue to exercise. That's aside from tactile, feeling the tube, feeling the weight of the
Right.
tube. Like, that's always going to have to happen in reality. But there are so many
Right,
other
yeah,
skills that you have to practice.
Yeah, I mean, VR is not a replacement for live hands-on training.
Right.
It's definitely not. But we do think as in conjunction with training, it's going to do nothing but help improve competencies. And sort of like you said, because you could do it live and there's no geographic boundaries around it, you can have an expert in brain-eating amoebas who might be, in Thailand, giving lectures and demonstration and giving their knowledge to learners all around the world.
And that brings me back to accessibility, learners who may not have access. Well, Joe, this has been incredible. Why don't we hop back over to the podcast studio out of VR?
Okay, sounds good to me.
Okay. Wow.
I mean,
All
it's awesome, isn't it?
That was fun.
I love it.
And I got to be honest with you, I didn't join the lab because I'm not a lab tech guy. I like to be out there and on the front end, and that was fun. Like that makes me reconsider whether or not I'd have a good time in a lab spinning
Yeah.
tubes in blood. So what I experienced just now was fascinating because there was this moment while we were in there where the tubes were broken. And
Yep.
again, if you did not get a chance to watch this on the YouTube channel, guys, give it a look. So I'm in there and I'm being told that I need to put the lab vials into a microfuge, but I don't know which ones are broken or which ones are too tall or which ones are underfilled. So, and there's no hints other than the tutorial that tells you check your tubes, make sure
Right.
it's balanced. So that type of gamification, is that something that you brought to the table that you're like, we've got to make this realistic and gamified, or was that always a part of the true north of what
Right.
this was intended?
So it's obviously we want to gamify as much as we can, but at the same time, this is content that's been sort of it's been created and blessed and reviewed by CDC subject matter experts, members of the clinical and public health laboratory community. So we don't want to get too crazy with it, right? It's
Okay.
this is science. This is serious. These are things that we need to really act appropriately with. But we tried to put as many real life scenarios into these
Yeah.
types of trainings that could help people in real life sort of notice, oh, hey, I remember when, because you load a centrifuge and have it not be balanced properly or put, the wrong kind of tubes in it. Not only could it, break and mess up the centrifuge and require cleanup and stuff like that, but centrifuges can be potentially really dangerous because they spin
They
at such
spin
high
fast.
RPMs. And
Yeah.
so we really want to make sure that people coming out of this sort of know the things to look out for in order to use a centrifuge safely.
So it's not a game, it's just gamified. I like that stance because it is professional and it has professional intent. Some people call it serious gaming or serious
Right.
games. But the idea of gamifying something, I think, lends itself to engagement or being able to have something sink into your memory. I don't know if I'll ever
Absolutely.
forget holding up a broken tube in VR and going, oh, that looks so real. I can't put this in the centrifuge. Even though, I mean, because it's a common error, but it's not that common. Like my tubes, I think I've had one or two broken tubes due to transit, but that's out of hundreds and hundreds of vials broken. So you want to train on these types of small micro events that
Right.
can be common and easy, also easy to prevent. Yeah, make sure there's not cross contamination. Make sure people don't cut their fingers. I had to put on my gloves at one point in the sim. That's really
Yeah,
neat.
make sure that the label's legible. I mean, that's a huge
Yeah.
one that people run into in laboratories of you're processing specimens, but you haven't taken the time to look and see that, oh, wait, I can't read this label. So we're wasting time processing it, and B, we're that person that submitted the sample is probably waiting for the results, and we're going to have to go back to them.
So who is eligible for this? We're talking about this being a professional tool. Do I have to work at a hospital? Does my supervisor need to assign me OneLab VR?
So again, it's available on the MetaQuest app lab for free. So just go to the store and type in OneLab VR. You can find it. You could also go to reach.cdc.gov. That's sort of our main website, and there's a tab there for OneLab VR. If you or your supervisors need more information, VR at cdc.gov is another great way to contact us. But no, it's really it's available for everyone. I think
Okay.
an interesting okay.
No, I just said okay. So your kids have access to it, not just because they're your kids, but because they've got access to the MetaQuest store, and it's anyone can join it, can check it out, can go play in a lab.
Yep, absolutely. One
That's
of the
cool.
things that we've heard from the clinical and public health laboratory community is that they're concerned because you do have to purchase a headset. You need a VR headset in order to take a VR course. And I think as educators, I think a lot of people know that training funds are usually the first thing that gets cut when budgets get tight. And so for that reason, the CDC has partnered with the Association of Public Health Laboratories, that's APHL, and we have a program in place that we call the VR Ready Laboratories program, where CDC through APHL, we're sending out, or APHL actually is sending out headsets for free to clinical and public health labs around the country, because we don't want the lack of a budget or funding to really impede this new generation of training that we believe in. And so again, if any of your listeners are members of the clinical and public health lab community, are interested in getting headsets, shoot an email off to vr@cdc.gov, and we'll start that process to hook you up.
So your guys' partnership is giving away headsets because that's how much you guys believe in this.
Precisely. We did lots of pilot testing before we really jumped into VR with both feet, because really it's a neat new slick technology, and there's a tendency for people to always want to try the newest, coolest thing. But we wanted the numbers to back it up to show that VR works. And so we did a pilot study. We sort of determined that yes, VR, we believe, works for laboratory training.
Yeah.
And we've been expanding that program ever since.
So you mentioned that you've got, we talked about the broken vials, and that not just being a common mistake or error, but a realistic one. And you guys have professionals that are validating what you guys are, these scenarios that you guys are creating and developing. So how frequently are you updating them? How many scenarios are there? Like, how often are there new scenarios in OneLab?
So we work with CDC subject matter experts as well as members of the laboratory community to sort of determine what training scenarios are most needed. We put out the call of, hey, what do you folks need? What's desperate in need right now? We get those training scenario ideas back, run those through our CDC subject matter experts, and determine the need. And our goal is really, we want to release at a minimum one new training scenario every quarter. Personally, don't tell anyone else this, I would like to release a whole lot more than that. And I think that's the great thing about OneLab VR, is because it's sort of this whole system. We only have to build a centrifuge once, and then we can use it forever. And so the hope is, as we build out more pieces of equipment, we'll be able to release them a lot more frequently.
Hey, Devin, I keep hearing about competency-based education from nurses online. What is that? Can you break that down for me?
Oh, yeah, sure thing. Do you know anything about cooking?
Yeah, I'm actually sous videing a couple steaks for tonight right now.
Oh, okay. Well then, so in cooking, chefs follow recipes, but often adjust ingredients and cooking times based on taste and experience. So in competency-based education, it's similar. It's about understanding the core objectives or the recipe and adjusting teaching methods, ingredients, and times based on student progress and feedback.
Got it. So like being able to tailor a VR sim to the situation.
Yeah, exactly. And VR Patients serves as your kitchen, equipped with all the tools you need to cook up the perfect learning experience.
Okay, so if I really wanted to tackle CBE in my nursing school, I should go to vrpatients.com and book a demo?
That's right. Visit vrpatients.com and start your sous videing today. So I want to ask you kind of like the touchdown question. Breaking into a new technology like this, being at the early end of the adoption curve, it means you're doing something that not everybody is doing. And so there can be short-term goals. And those short-term goals can be, we want to get more people in VR and we want to validate what we're doing with this clinical education. Is there a longer-term goal that you see with what OneLab VR can accomplish in 10 years?
Oh, absolutely. I think our short-term goal, our goal for OneLab VR is always, we want safer, and more productive laboratories. We want our laboratory professionals to feel confident and to do procedures and keep themselves safe, to do the procedures more effectively. So that really is the whole goal. The VR, it could be really any modality. It's the ultimate goal is we want laboratory people who work in labs just to be safe, have that education, be able to come to OneLab VR if they need a refresher. I think the other benefit is always the next generation laboratory workforce and luring in new students who hadn't considered a career in the laboratory, as well as laboratory professionals who have left the career, luring them back. But yeah, with OneLab VR, it really is, the goal is we want safer, better, more effective labs.
That sounds like it rings true to me. A very large overarching goal of make labs safer, period. And the reason why I like that is because you really have to innovate if you're going to make all labs safer, because accessibility is a thing. And so not everyone has an autoclave.
Right.
And so
yeah, absolutely.
I could see that being an exceptional value with VR, because you were saying, look, you could make a lab safe with any training modality, but we're not just trying to make one lab safe, even though it's called OneLab, no pun intended. We're trying to make labs safer, and that improves public health. That's a part of your healthcare. I don't know if people realize this, but when the physician or the nurse draws your blood at the bedside, it goes to the lab. And if they break or spill or whatever, you have to get poked again. They have to come back and draw it again. Or if it gets switched, you could get misdiagnosed. Like, there's many bedside errors that can happen in transit of biospecimens. And that's at a first world country, well-funded hospital. Those types of things happen.
Absolutely. And I think the great thing about virtual reality is, I think as the technology evolves, obviously the price is going to come down, the footprint of it is going to come down. I figure, in my mind, eventually it's going to be built into phones or the glasses like you're
just
wearing.
Like glasses like this, yeah.
Exactly. And
Yeah.
I think if you think about just like internet speeds in general, you go to the middle of the Sahara Desert, chances are you're going to have a faster, stronger internet connection than you have here in the States. And so using virtual reality and these online training mechanisms, there's a worldwide impact that they could have. Like you said, I could get training on pieces of equipment that are not available to me. We may have an autoclave at my laboratory, but that autoclave is being used, and you don't
Well,
want
that's another good point.
students messing with an in-service, laboratory instrument. And so, for that reason, I think it's going to be great.
Let's talk a little bit about accessibility. Are you guys
Yep.
using this in areas that don't have access to things? Have you guys, I know this is all new, but have you guys tried that yet in other countries, perhaps?
So currently, we're really sort of focused on just the domestic, the U.S.
Sure.
We have run into sort of unforeseen issues in some of the laboratories where, for example, they didn't have Wi-Fi, and that was
Right.
something that we completely didn't consider. And how do you get one of these headsets connected if you don't have Wi-Fi? And obviously, with any new technology, you have sort of IT and security things that people sort of get concerned about. But we've had really great results in really working with some of these smaller laboratories to get them up, get them online with OneLab VR. Here's an interesting story. So during the pandemic, obviously a lot of people were forced to work remotely. And for the VR team that I'm the lead of, that was a huge benefit to us, because that's when we made the decision to go all in on this multiplayer environment within OneLab VR. And because of that, the developers, our subject matter experts, our reviewers were all able to meet in VR in the laboratory that they were reviewing and walk around it together and be able to say, oh, hey, look, that autoclave is way too close to that doorway or that air conditioning vent. Or, hey, the sun looks weird coming through this window. So it was really an additional way to just sort of show our stakeholders that VR is more than just a game. It was
Yeah.
really a learning tool that can evolve as we evolve with it.
Well, I'm excited. Thanks for letting me play around in OneLab VR. We are going to put links in the show notes for everybody. And before we wrap up, we're going to do a lightning round, and then we'll let you plug all of your links and information so people can send you questions.
Fantastic.
So are you ready for the lightning round?
I'm ready.
All right. What is your favorite color?
Favorite color, kind of a charcoal blue.
No, yellow. Ah! What is your favorite way to unwind after work?
Probably unfortunately, just sitting on the couch with my wife watching some good trashy TV.
Well, you work in an industry where you're putting on a headset, and that's usually other people's escape. And so
True.
you're escaping at work. Do you have a favorite book?
Favorite book? Oh my gosh. Okay, my wife's gonna kill me. So I am way into the Warhammer 40K universe. Think kind
All
of,
right.
Dungeons and Dragons in
That's
space.
awesome.
So those
Hey,
books,
man.
yeah.
Great imaginations in that space. If you could have dinner with a historical figure, who would you have dinner with?
Let's see, historic. If I could have dinner with a historical figure, I think I would like to have dinner with George Washington and just kind of say, hey, what do you think about what's going on?
Okay, so if you could travel to any time period, where would you go?
I've thought about that. I don't think I would because, you get a scratch on your leg, in,
With the
if you're
butterfly
watching the
effect?
pyramids being built and you're gonna die and, I don't, yeah, I'm good right where I am.
You're good. Okay, that sounds good. All right, and our closing question is, if you had any advice for someone who wanted to do what you do, what would you tell them?
So as I said at the beginning, I'm a video film guy. I went to school to go make movies and discovered that the government has amazing possibilities for employment. The CDC, we have, staff photographers. So if you're a photography person, you could potentially get a job. Obviously web developers. You don't have to be a scientist to work at the CDC. I love my job and I love the creativity that leadership has allowed me. They've given me lots of chances to go out on limbs, especially with VR. And I think for me, the thing that's really served me best is just being true to myself, not settling for the status quo, sort of always trying to push the boundaries a little bit and just get us sort of one step closer to better. The way we've always done things isn't necessarily the best way, and I think VR is a great example of, hey, let's go down this road and see where it takes us. This may be a great teaching methodology.
I like that one step closer to better, because I think when you try to get someone to be better and you present them with 10 steps or some leap, it's scary.
Yeah,
But
it's a risk that you take.
Step. Yeah. All right, Joe, this has been phenomenal. I hope that everybody goes to reach.cdc.gov/OneLabVR and try it out for free. Download it on the MetaQuest store and start spinning some labs in a centrifuge. Joe, where can people find you if they've got questions or they want to learn more?
Yeah, so the best way is if you want to shoot me an email, the VR@cdc.gov is going to be your best way to get in touch with me. to inquire about our VR Ready Laboratories program. If you have any questions about OneLab VR, and yeah, again, as you said, Devin, that reach.cdc.gov, lots of great laboratory resources there, tons of e-learning courses and video job aids, all kinds of great stuff. And yeah, that's pretty much it. I'm around. I love talking about this stuff, so reach out and talk to me.
Yeah, and listen, everybody, if you're listening or watching on the YouTube channel and you work in nursing or in a hospital or on an ambulance or anywhere, and you know a lab tech or a supervisor, or you are acquainted with a hospital, get them to reach out to vr.cdc.gov and get them some free headsets. Our communities deserve to be upskilled and uplifted with new technology. So let's all join 2024 and get them some free headsets because they're here, they're there, they're available. All right, let's go. Everyone, have a great day.
Thanks, guys.